everyone. We'll be starting shortly. So my name is Momina, and I'm the Vice President of Events for Students for Global Health student organization at UCSD. And I just wanted to say thank you for attending the Fall Quarterly Conversations in Global Health. And just as a note, this event's also going to be recorded and posted online, so you can watch it after and go over anything that's discussed. So before we begin, we just wanted to highlight some upcoming global health program events. We hope to see you at these future events taking place that are related to global health. So the first event is the Global Health Mentor Mentee Program applications. The deadline has been extended to this Friday, the 29th at 12 p.m. This is a great opportunity to connect with other global health students and expand your network. Mentors and mentees will discuss courses, global health topics, student involvement, and career and post-grad goals. The second event is the Global Health Reps Office Hours event. This is going to be on November 4th, 5 to 7 p.m. You can come get your questions answered by your global health representative. The winter 2022 schedule will become available on November 3rd. So this is a great time to get any questions answered. The third event is the Latinx/Chicanics in Global Health Mentorship Hours. These mentoring sessions are open to discussing fieldwork, experiences, challenges, research methodologies, decolonial perspectives of global health, or preparing a personal statement or CV for grad school. There's also you can also address other topics, including particular interests coming from Latinx and Chicanic students in the Global Health Program. These sessions are on Wednesdays from 3 to 5 p.m. The last event coming up is the Students for Global Health GBM. This will be on November 9th, 6 to 7 p.m. The topic for the meeting is going to be Masters in Global and Masters in Public Health. It'll be an info session going over those topics. You can also see the latest Global Health news blast for more information. Also, additionally, for those in global health courses that are receiving extra credit, there's going to be an online sign-up sheet posted in the chat once the event ends. I'd like to introduce this afternoon's MC and Global Health Program Director, Dr. Thomas Shawdash, to the stage.
Greetings, I'm Professor Tom Shawdash. I'm a professor in the Department of Anthropology, and I'm the director of the Global Health Program. Welcome to our fall edition of Conversations in Global Health. This is a recurring event here at UC San Diego, made possible by the Global Health Program, the Students for Global Health, and Ia Healthcare. As with all our events, the goal is to bring the global health community and the local San Diego community together to discuss important issues in the field. Though we're forced into the technological solution provided by Zoom, we also have to acknowledge the unintended benefit of being able to reach a much wider audience than with our usual live events. Before we begin, let me express special thanks to our co-sponsors and individuals who have made these events possible this year. We'd like to thank the Global Health Institute, the Center for Global Mental Health, and the Global Health Program for providing support and sponsoring this event. Additionally, we'd like to thank Ia Healthcare for their generous support and sponsorship. We'd also like to give a huge thank you to the community and student organizations tabling here today for spreading knowledge and resources on such an important and relevant topic. Finally, we'd like to thank the events committee led by Global Health student Momina Syed and comprised of board members from UCSD Students for Global Health, as well as our Global Health Advisor, Erin Warren, and Program Coordinator, Brittany Wright, who all contributed to putting together this afternoon's conversation. Given the extra technical challenge, I want to make certain we give abundant thanks to Brittany and Erin, and not only for this event, but for everything they do in making the Global Health Program as successful as it is. As I mentioned, one of our event sponsors is Ia Healthcare, and we're very grateful to be partnering with them on new initiatives. We want to share some more about their company and how they are supporting our program And we want to welcome those IA staff and clinicians who are with us today on the webinar. Let's take a look at a brief video prepared by
Hello, I'm Amber Zeeb, Vice President of Employee Experience at Aya Healthcare. As the largest travel nurse agency in the country and a leading provider of locums and per diem clinicians, we work to ensure hospitals are fully staffed. During the pandemic, that has meant significantly ramping up our efforts to help communities fight COVID-19. We believe access to healthcare is a basic human right. That's why we're proud to sponsor today's conversation in global health, exploring the inequities in LGBTQ+ health, and to discover how we can overcome those inequities and advance LGBTQ+ health and well-being. As a San Diego-based company, we're honored to sponsor the UC San Diego Global Health Program and the wonderful work you do.
Thanks to Amber and all our friends at Aya Healthcare for that message. I also want to point out that through generous support from Aya Healthcare, we are able to announce the Aya Scholars Program. Global health majors and minors can now apply for funding of up to $1,000 to support their global health field experience work, which is a requirement for all of our global health majors and minors. The criteria and application for the Aya Scholars Program can be found on our Global Health blog and has been sent out in the Global Health News Blast. The link is also being shared here in the chat for this webinar. The application is open and the deadline is January 15th, 2022. Before we get into hearing from our panel of speakers, we'd like to begin by highlighting some of the organizations on the UCSD campus and in the greater community that are relevant to today's topic. In our usual quarterly conversations format, our tabling organizations are set up in booths at the physical event, explaining how their work is related to the topic at hand and providing resources on how to get involved. Because of the nature of this virtual event, we'd like to invite our tabling organizations to speak for a couple of minutes and share a bit about the work they do and the work they are doing to provide support services and foster community for undergraduate and graduate students. First, we want to highlight QDPOC, a student organization at UC San Diego. Though they're not able to be with us today in person, or even in 2 dimensions online, queer trans people of color, QDPOC, creates a safe space to dialogue, educate, and socialize around LGBTQIA+ identified people of color. We felt that it was important to highlight them and share their information, and their social media handles are also available to be seen and copied in the chat. Next, we would like to invite Sharon Aravind from the OSTEM organization at UC San Diego to speak about that organization.
Hi, everyone. I'm Sharon. I'm just going to pull up our presentation. 1 second. Wait. Can you guys see my presentation?
Yes.
Okay, perfect. Okay, present. All right. So hi everyone, I'm Sharon. I'm a 2nd year cognitive and behavioral neuroscience major, and I'm the current VP internal for OSTEM at UCSD. So what is OSTEM? OSTEM is a nationally recognized organization that is geared towards the personal and professional development of queer/LGBTQIA+ students who are interested in STEM fields through social, educational, professional, and philanthropic and outreach programming. Our mission is to empower LGBTQIA+ individuals in STEM to innovate traditional underrepresented spaces through professional and personal development opportunities, a comprehensive resource network, and a community-centric culture of talent, leadership, and activism. And I'll get into how we do that through our events later on. And our vision is to imagine an intersectional world in which LGBTQI plus individuals in STEM can achieve success and are celebrated. A little bit history about our org. Our org was started/created on September of 2016. And in November 2019, we won Chapter of the Year at the OSTEM National Conference. So these are some planned activities we have for the upcoming year. We try to split them up into social, professional development, personal development, and community opportunities. And I'll get into those here. So for personal development, we have the series called Out and Learning, where we discuss a certain topic. A recent event that we had was Out and Learning, a discussion on race and sexuality. And we talked about the intersectionality between someone's racial identity and their sexuality. And we also have LGBTQ plus panels that involve speakers, UCSD LGBTQ plus faculty, etc. And for community, we have weekly events such as Coffee, where students, LGBTQ plus students, can just hop in on our Discord or in person before the pandemic and just chill out, study, and just talk about their days, etc. And we also have de-stress socials before finals that involve yoga, mindfulness, drawing, etc. Our tutorship program is a mentorship program where we assign a mentor, and then they check up on the mentee on their projects to see how they're doing, their mental health, etc. And for professional development, we have the OSTEM National Conference. We also have Out in STEM mixers, which involve we usually have faculty, UCSD out faculty come in and talk to students about their experiences and how it is to be out in STEM fields. We also have lab tours and lab tours that explain research, but also explain how it is to be out in STEM, which is a very important focus for us because it's kind of STEM fields are kind of underrepresented when it comes to LGBTQI plus individuals. So we're trying to make it a more comfortable and safe space for them to be involved. And with leadership, we have a junior board, and we also have the executive board as well. And this is our socials, so follow us. You can email us about any questions. We have a newsletter that we send out weekly, and this is our lovely board of members as well. And I'd like to thank everyone for letting OSTEM present today. I'm going to stop sharing. There we go. Thank you so much.
Thank you, Sharon. And finally, I'd like to invite Jackie and Shreya from Students for Global Health to speak about their organization.
All right, I'm gonna share my screen as well. All right, can you all see my screen?
Yes.
All right, awesome. So hello everyone, my name is Jackie. My pronouns are she, her, hers, and I'm currently the president of Students for Global Health at UCSD. So today I just want to talk a little bit about who we are, what our mission is, and how to get involved for those of you who are interested. So our mission statement as an organization, I'm just going to read it real quick. We are a UC San Diego student-run organization dedicated to representing the undergraduate community of global citizens, as well as to engendering and promoting a spirit of collaboration between UCSD students of varying academic disciplines in the field and practice of compassion and global health. And our goal for this quarter is just to continue building a community of undergraduate students here at UCSD who are dedicated to advocating for global health and creating a platform under which student-run health organizations at UCSD can unite and collaborate. So I'm sure for those of you who are not familiar, wondering who are we, what do we focus on, what do we stand for? So these are just some things that kind of sum it up. We are a group of students who are passionate and adamant about the idea that good health should be attainable to every human being on the planet, regardless of gender, income, geographical location, sexual identity, or religion. And we are a group of students that believe that global health is and should be multidisciplinary, And lastly, we are a group of students that believe in the positive power of collaboration and the power of individuals when they're united under a common goal. And these are just some reasons why you should be part of our organization. There's networking, peer mentorship. You can meet a lot of other students who are passionate about other global health issues and learn about new global health issues that you might not have been aware of before, as well as involvement in fundraisers, awareness events, and you can also be a student leader in our organization as well and help spread awareness about global health on campus. And now I'm going to hand it over to Shreya.
Hey guys, I'm Shreya. I'm on the events committee for Students for Global Health, and I'll just be talking about some of the requirements to being a member and what being a member entails in the club. So the general membership requirements are just to register as a general member. That is the link to register or sign up. And we have GBMs and quarterly conversations, and you should try to attend 2 out of the 3 GBMs we have per quarter, as well as attend other events during the quarter, such as socials and fundraisers. And these are fun to attend, so like, why wouldn't you want to do it, right? And then the next upcoming event we have for the fall is our 3rd GBM, and it's going to be about Masters in Public Health or Global Health. It's just going to be a little informational session. It's going to be Tuesday, November 9th from 6 to 7 on Zoom. And again, there is the registration link for the next GBM. And lastly, I would like to invite everyone to follow us on our social media. There's our Instagram, we have a Discord, Facebook page, as well as a blog and our link tree with all of the following links. So thank you guys so much for listening.
All right, thank you very much, Jackie and Shreya. Thank you to all of our tabling organizations for sharing their resources that their organizations provide and for all of the work they do on campus. To get to the heart of the matter, barriers and stigmas faced by the LGBTQIA+ community to accessing health services are a global concern. Research suggests that LGBTQIA+ individuals face health disparities linked to societal stigma, discrimination, and denial of their civil and human rights. Discrimination against LGBTQIA+ persons has been associated with high rates of psychiatric disorders, substance abuse, and suicide. Experiences of violence and victimization are frequent for LGBT individuals and have long-lasting effects on the individual and the community. How can we improve the determinants of health that threaten the welfare of LGBTQIA+ individuals in our communities and across the globe? We're privileged to have 3 distinguished panelists with us to share their expertise and experience as we explore this question. Our speakers today are Dr. Sean Travers, Dr. Amy Siddivati, and Pamela Hallowell. I will introduce each in turn. First, Dr. Sean Travers. Note that each speaker, according to our regular format, gets 10 to 15 minutes to introduce themselves and present, and then we'll have a group discussion and question and answer period after that. Let me first introduce Dr. Sean Travers, who is a campus diversity officer and director of the Lesbian, Gay, Bisexual, Transgender Resource Center here at UC San Diego. An active representative of the bisexual community, he has presented at Harvard College, the National Conference on Race and Ethnicity, the NASPA Multicultural Institute, and numerous trainings on campuses throughout the country. At UC San Diego, he's led the Undergraduate Diversity Leadership Institute, the Building Communities for Social Justice Practice Institute, Anti-Racist Practice Leadership Groups, LEAD Fellows, and the Culturally Competent Management Program through Human Resources. Dr. Travers currently serves on the board of directors of the San Diego LGBT Community Center and chairs the San Diego LGBT Community Leadership Council. His current practice and leadership involves a deep understanding of intersectionality, power, privilege, oppression, and the dynamic tension inherent in university environments. Please welcome Dr. Sean Travers.
Thank you so much for that kind introduction. Always overwhelming to hear that. But as I heard that last line and thinking about the intersections of race and gender and sexuality and looking at my peer panelists and thinking, hey, look at the white guy going first on the panel, right? How does gender function? How does race function? And gosh, how did that happen? And I'm just always amazed at how we can always look at things through a lens that helps us understand how these things function systemically. I want to start by really continuing to position and think about, is everything sharing right? Thank you, Amy. Start by thinking about the land that probably most of the 117 of us on this are on. I think it's always good to start there. It grounds me. It helps me literally ground myself on this land. This is a statement that my colleague and the director of the Intertribal Resource Center at UC San Diego, Dr. Elena Hood, has crafted to start to name the realities of what it means to be on Kumeyaay land and what it means for all of us today to be in this space, this unceded territory, and to take up that space and to honor that land as we sit here today, occupying it through many means that destroyed people and cultures and communities, including indigenous understandings of gender and sexuality that could have helped us had they survived brutal colonization and missionary attempts. So I want to honor the land. I also want to talk a little bit about the LGBT Resource Center. I work with incredible folks here, the student staff, the career staff, my peers, and how we focus on racial justice work and addressing intersectionality, our work, and remembering that Black lives matter even when someone wasn't killed yesterday. And that trans Black lives matter in this work when we think about centering those that have experienced some of the most violence. And so when I was asked to do this today, I really had to pause in thinking about how I approach the work that I do, because what on earth is global health? That's not my field. That's not what I think I do. So I did what I think you're supposed to do when you don't understand something. I Googled that, right? I'm like, let me Google this, find out what the heck UC San Diego is doing in terms of global health. What do they think they are? And they meaning we, I'm part of UC San Diego too. What is this global health thing? And this is what y'all say, that you say it's an area of study, of research, of practice that places a priority on improving health and achieving equity. Oh, there's that word, equity. I love that word. That's the division I work in, equity, diversity, and inclusion for all people worldwide. Emphasizing transnational health issues, determinants, and solutions. Many disciplines, maybe even what I do, right? Many disciplines within and beyond the health sciences, promoting interdisciplinary collaboration, and is a synthesis of the big picture, population-based, and the small picture, providing care, individual clinical level. So I tried to unpack that a little bit. Okay, let's take sentence one. Okay, this is an area of study. So I think San Diego and UC San Diego are part of the world, right? So the last word there is worldwide. So let's start here. I'd actually like to argue that let's start our global health work here in improving health and achieving equity in health here in San Diego County, at UC San Diego on our property. That's how I want to approach global health today, is that we should start here, because often we can have the most impact here. Let's think about what else it does. It emphasizes transnational health issues, determinants, and solutions. That transnational word really struck with me. Luckily, if we want to do anything transnational, it's less than 30 miles away. That border, we are the closest UC to the border. Transnational, when I ride my bike every day, I look at the border. I look at Tijuana every day. Transnational is so accessible to us. Equity, you know, when we think about the transnational health issue, it's LGBTQ plus equity. Equity is the issue we're thinking about today in terms of global health. When the determinants of these health issues, I think about the disparate outcomes. What are the determinants of those disparate outcomes? My read for the LGBTQI plus community, it's transphobia, it's homophobia, it's biphobia, it's sexism, heterosexism, and monosexism. Those are the systems, I think, that are determining the disparate health outcomes for the community I love, the community that I serve. And what are the solutions to that? Well, I think one, they're community-based, right? So we have to be engaging with San Diego and with UC San Diego deeply, because I think communities can figure out what to do to address their own health. So that deep dive that we're doing today in San Diego, UC San Diego Health, the broader San Diego community starts to do that, starts to center the right thing. So my read is, yeah, we're doing that second sentence, right? This is a beautiful thing. What about that next part? It involves many disciplines, right? Within and beyond health sciences, and it promotes interdisciplinary collaboration. Okay, well then what do I do? Well, for me, my discipline, right? My discipline is higher education and student affairs, really focused on social justice and LGBTQIA plus educational leadership. And so for me, when I think about my work too, I'm trying to collaborate with many areas to achieve LGBTQ plus, I always say IA plus, so I'm stumbling on that, health equity, right? That I'm in this with y'all. Let's figure out how we can be cross-disciplinary, because I want to find my place in global health too, to make a difference for the community that I serve. That last piece, the synthesis of population-based, big picture, and individual level clinical care. You know, when I think about that, we try and affect change for the LGBTQI plus population, as many, I even said here on the slides, most in global health might imagine, we have a challenge. I'm not going to speak to that challenge deeply. One of my peer panelists might do that, but I think the challenge is data. What do we know at the population level about the L, the G, the B in all of its manifestations, pansexual folks, omnisexual folks, fluid folks, the T, that tiny little letter that is trans women, trans men, non-binary folks, genderqueer folks, two-spirit folks, the I, the A, you know, that population. We use that acronym as if it's one thing. It's a lot, and it's even more than those 7 letters. And individual clinical level care is often guided by population-based research and studies, right? We want to do things that we know can make a difference, so we do research on it to know they make a difference. How can we find our community in the population and provide them with individual level care without a much deeper understanding of the population? I think it's a challenge. I think it's a real challenge. In particular, if we're talking global, we might have some ability to do things at UC San Diego County, right? We might have some population data there, but globally, whew, that's a big ask for population. So if I think about my work, right? my role in global health, if I argue that UC San Diego is part of the globe, right? The LGBT Resource Center has a role. We do stuff at the LGBT Resource Center around mental health issues. One, we partner with CAPS, Counseling and Psychological Services. This is my colleague and dear friend, Dr. Kat Thompson, part of our LGBTQIA plus community, works here at the center, has a liaisonship, connects with her peers in counseling and psychological services to do the work around LGBTQI plus issues. In particular, Dr. Thompson works with our transgender and non-binary community to really serve that community on campus at UC San Diego. That's how we're achieving mental health equity. How are we achieving social health equity at UC San Diego's LGBT Resource Center? Actually, a lot of ways. We do a lot of social stuff. We have an affiliates program. We have a community care leadership program. We have a social justice peer educator program. We have office hours for all our staff. We have trainings that we provide, not unlike what I'm doing right now. We have programs that we do. All of these things are deeply social. Of course, you already heard about some student organizations today. We have other student organizations. Not all of these are active right now. This is the pre-pandemic list, I should say. It's the pre-pandemic list. But you already heard about QTPOC, which is active. You already heard about OSTEM, which is wicked active. Wow. There are other groups that are active as well. That's how we get social health equity. We do mixers, even if it's not a student org. Look at all of these ways that we mix things up. QTPOC connects, trans and non-binary folks connecting, femmes of color, fluid folks, women loving women, transfer students, ACE and ARO folks. How do we get that physical equity, that physical health equity? Student Health Services does that for our non-binary community, our trans community. We have excellent insurance benefits. They do hormone therapies, gender affirming services, vocal coaching, hair removal. That's all covered through UC SHIP, the Student Health Insurance Program, UC SHIP, which is underwritten by Anthem, which is a large nationwide company. There's step-by-step guides to access this. There's links here in this slides that'll be provided to you later. There's some big overviews. There's some incredibly confusing and overwhelming guidelines that Anthem gives you for trans people. Oh my God, they're ridiculous. Sorry, excuse my language. Oh my goodness, they're ridiculous. And the checklist is even more overwhelming. But information is power. So to see them is helpful, right? But they're just overwhelming. We do have at UC San Diego gender affirming surgeons and care providers. We have an extensive list. Very, very excited to say that just 3 months ago we hired a specialist that does bottom surgeries, both trans feminine and trans masculine bottom surgeries. I've seen them over Zoom. I have not met them. I have a one-on-one connection with them soon. I'm super excited. UC San Diego Health has never been able to provide that in San Diego County, and we can do that now. And I'm super excited about that service. Again, trying to change health equity here. What is global health? It's all of these things. What can you do? What's my ending argument as I finish up my time? We're part of the globe. You participating today are part of the globe. Our population includes transgender and non-binary people. Your education as students, your learning, when put into action, can make a difference on this campus for the health of our transgender and non-binary community. I need you to notice our absence when we're not there. I need you to demand our inclusion from folks who are not marginalized. And that helps us all work for health equity for UC San Diego's LGBTQI plus community. Thank you so much for inviting me today. Happy to answer questions at the end after my peer panelists go. Thank you.
Thank you very much, Dr. Travers. Thank you for picking up and elaborating on our definition of global health. And even more precisely for picking up on one of our mottos, which is that when it comes to global health, the United States is part of the globe. Don't forget the USA. And being right down to the specificity don't forget the land that you stand on, the land that you inhabit, and the university that you inhabit, because that's also, we are also part of the globe. So thanks again for that. Our next speaker is Dr. Amy Siddivati. Dr. Siddivati is the Chief Medical Information Officer of Population Health for UC San Diego Health and Clinical Professor in the Department of Medicine. She's a board-certified physician in general internal medicine and clinical informatics. She leads efforts at UCSD Health in population health innovation, digital health, artificial intelligence, quality, and equity. She's deeply passionate about making data actionable to serve patients and the clinical teams who care for them. Please welcome Dr. Amy Siddivati.
Well, thank you. It's my delight to be with you, and I'll share a screen in just a minute here. It's always an honor to follow Sean. Sean is an incredible advocate and has really helped us prosper in thinking about how to expand and make services in our health community better for the community that we serve. So thank you so much, Sean. I also want to thank Momina, who was so helpful in getting me connected with this group today. And I have a special thanks to Aya. As many of you know, I'm a doctor, so that means I've spent a month in the last year in our inpatient setting, taking care of patients with COVID, and often along, Aya provided nurses. I've also been in the community. I was at San Diego Pride and delivered vaccine to the front line, working with our community-based organizations, and often Aya was at my shoulder. So I have to say, it's very touching that they're sponsoring this event, and I have the utmost thanks to them for the nursing care they've provided to patients in this last year. All right. Okay. So we'll kind of shift gears here. So as you've heard, I wear a couple of different hats, and today I'm really excited to talk to you about the intersection of thinking about LGBTQ plus health equity and informatics. So my preferred pronouns are she, her, hers. I'm a clinical professor, as you heard. I also think about statewide records and have oversight with my co-Garth for the birth and decedent registry for the state of California. I just hope this catches your breath, because I think the point here is not invisible. And I wonder for some time, why has it been so hard to have good data about how to care for our patients? And what does that journey look like? You know, many of you have been studying a little bit health, or you're interested, and you hear about things like this quadruple aim. So you hear about, hey, we can make a difference in populations, or we can change maybe a person's experience of healthcare. We can make the healthcare better value, cut out the waste, do things in a way that really better makes each dollar go further in sort of really making better care. And we can also make sure that teams of people that care for the patients also are well. But only recently did we actually have the courage to stand up and say that equity and inclusion is a really important piece of the puzzle. And I think some of us have been doing this work all along, but we really haven't made it sort of structurally a priority. And so one thing at UC San Diego that has been evolving, and maybe you've been seeing this, is really putting governance to work to prioritize some of these efforts under an anti-racism task force structure, which to me, that means we're supersizing right up the chain and putting this as one of our top priorities. So that's great. But what about the not invisible? How do we get there? Okay. Well, I think that informatics is a piece of the puzzle. And this, I hope you can see, there are mountains in the background here. So I had the joy of hiking in India. That's where my last name is derived from. And when I was up in Kedarnath, I hiked and I hiked and I hiked and I hiked and I hiked. And I think it was 17 kilometers straight up a mountain in the foothills of the Himalaya. And I was tired by the time I got to the top, but I eventually got there. It does feel like the journey to make a difference in LGBTQ plus care is a hike. And the hike that I had, which was one day, is very different than this hike, which is really a lifetime commitment. And the informatics backbone to this really starts at thinking about how our nation, how our federal organizations classify, and might I feel sometimes segregate by their classification. So how do we actually integrate, allow intersectionality, and also make visible, health disparities? So this has been something we've been working on. I didn't think part of my journey to this mountain would include training thousands of healthcare workers, but who knew? They lacked basic cultural competency to be able to address individuals showing up at the front desk, calling into our call centers. So before we ran forward, we had to stop everything and insert miles of our journey into just basic steps in sort of cultural competency and literacy around our LGBTQ patients. And so that's a journey that's ongoing. We need all of you. We need our community to help. It's a heavy lift to really make that strong. But part of this now also means that we've changed the technology such that patients can also identify for themselves as part of their patient portal, as part of sometimes e-check-in moments, and update their sexual orientation, their gender identity, and other demographic features, which is great. We also have that opportunity to inquire, about someone's preferred or chosen name. And so that's fantastic as well. Now, this is a journey. There's so much more to do to get all of this into workflows, adopted, and then again, utilized in the way we expect. So I've used some acronyms here. These include REAL, SOGI, and then EDI. So for those of you less familiar with the term REAL, it's just a way to speak to the ideas of race, ethnicity, and language as a set of data. And typically this also has an ethnic background piece as well. So when we put them all together, we talk about REAL. And then SOGI is the combination of sexual orientation and gender identity. And so as you can see, we have decent data collection at this moment. So we started really not super great, even in real data. And we run now for all patients that are active at UC San Diego, about 95% of our patients have complete data, which is wonderful because that allows us to look for intersectionality and, really look at equity. But we have plenty of work still to do with, I think, SOGI data completeness. What you're seeing here is only in our primary care practices for individuals that have had 2 or more visits. But it's progress. I hope you can see we actually started at 0, and then we first measured ourselves at 10%. And you can see we've come a long way. But keep in mind, someone may not be feeling comfortable in our healthcare setting to also share their gender identity. So I cannot say confidently, I feel that there's more work to do. I don't think we actually capture as much depth in that. But I thought I'd give you a look at kind of some of the numbers just to see. So this is a primary care view, and this is any patient that stepped in the door in an office in a primary care setting in the past 3 years. And you can see sort of individuals who identify by sexual orientation. So what's great is we now have visible, individuals who might classify as lesbian or gay in our system, right? And they're measurable, right? This is fantastic, right? You can see individuals who identify as bisexual, more than 1,000. So again, I'm like, woohoo, this is great. This is great. We're making progress. But you can also see, I hope it caught your eye, 38,000 people who haven't shared the data at all. And again, individuals who may be misclassified in a straight category, depending where they're getting their care. For instance, what if someone shows up at an urgent care and is asked these questions? Will they feel comfortable sharing their sexual orientation, yes or no? So just something to keep in mind. Now, this is a view of gender identity. So again, I hope you see something else in this story, which is individuals who maybe we aren't seeing in the picture, right? So yeah, hopefully you had to sort of put on your bifocals to take a peek, because the trans community measured in the primary care setting is less than 100, right? I should say trans male, and then for trans female, also less than 100, right? Certainly you can see different categories. So non-binary, we have about 150. We have more than 700 individuals who choose not to tell us, right, what their gender identity is. So I think, again, you can see the data. The point here is, well, not quite invisible, but probably some more work to do. And without cultural competency in our practices, without inclusive care, it's very difficult to drive this. So again, training is a really, really important piece. Training the workforce to be more inclusive, then we can actually truly have better measures of what we're doing. And then we can actually get to some of the questions that we have around outcomes, which are critical. All right, so now you may ask, that's all good, but how do we actually start to look at things? Look at this. It's a beautiful design. So this is called business intelligence. It means it's a report, but on the right side of the report, there are filters. So you can pick and choose different types of filters. And I hope you can see on the far right in very small print, sexual orientation and gender identity. What does this mean? You can look for intersectionality and access to new visits, persons who canceled. You can try to actually have a better sense what's going on in what we do is try to see what's going on in our organization. Now, I hope you just realize something else. Who's gonna look, right? So if you're not passionate about the work, if you don't have a governance to help direct the work, it's still invisible. It's sitting there sort of under a filter that never anyone looked at. So this is an example of this is our classic health center board. And this is looking at sort of our case mix index, looking at mortality, looking at sort of discharges. And the point is, just like the prior dashboard, there's a filter where you can actually select based on someone's sexual orientation. And here I filtered for gay and lesbian just to show it recomputes all the data. And now we can actually look at comparisons for different outcomes. So again, the point of this is it all started with cultural competency, and then activating our patients to be able to share for themselves their sexual orientation and gender identity. And then it enables us to try to identify where there could be gaps. So I would say the work we've done so far is here. Now, the next set of work are, okay, well, where's the variance and how do we address it and bring back better care? And just knowing kind of the work that you're interested in, I couldn't say all the other without also bringing in the communities that we live. And we're super excited. Every patient at UC San Diego Health has mapped a Healthy Places Index that's mapped to their address. So Healthy Places Index is unique to California. So if an individual resides with a primary address outside of California, it's not mapped, but this is wonderful. It allows us to understand where people come from and the community's ability to provide health to the individual, so that then we can think about the individual in the middle. Who are they? What are their health conditions? The social determinants that are around them, what might be some of their lifestyle challenges, what might be perhaps mental health or other things. And then around that, what is the context that the individual resides in the health there? So that's kind of how we think of things. And lots of thanks to many people who make all this possible. How do we take this to a truly global scale? Well, that question is back to you.
Thank you very much, Dr. Siddivati, for talking to us about visibility, talking to us about intersectionality. And one thing that you included that I have to point to is the recognition of caregivers and the stress that caregivers face, and including them in our concerns and considerations as we think about global health in the local setting. Our next speaker is Pamela Hallowell. She is a licensed marriage and family therapist who specializes in working with children diagnosed with autism spectrum disorder, transgender, non-binary, and gender non-conforming individuals, homeless and transitional age youth, and individuals in LGBTQIA+ communities. She graduated from UC San Diego with a bachelor's degree in psychology and a minor in Black Studies, and graduated from Argosy University with a master's degree in counseling psychology. She's president of the San Diego Black LGBTQ Coalition, a member of the Gender Fluid Collective, and a member of the California Association of Marriage and Family Therapists. She is the first Black transgender female therapist that has ever worked at the San Diego LGBT Community Center. She also works with transgender and gender non-binary individuals who require a letter to access care for gender affirmation/confirmation surgery, including providing resources and short-term case management support. She's also written various articles pertaining to transgender rights and mental health. As a therapist, a woman, a transgender woman, and an African-American woman, she's aware of both her role in the community and of the need to work to fight against discrimination in and outside the center. Pamela also maintains a private practice part-time and works to both empower and mobilize the community to make change. Please welcome Pamela Hallowell.
Good afternoon, everyone. Thank you so much for the invitation and for allowing my organization, San Diego Black LGBTQ Coalition, to be present here today. Thank you also, Dr. Travers, for the land acknowledgement earlier today. I found that to be really helpful, and it's a great space to kind of start these kind of conversations. So I'm sharing my screen and I'm gonna test to see if you all can see that. Great. So I'm gonna give also a brief disclaimer. In my real life, I'm a therapist. So that is typically not presenter / professional with working big audiences. So please forgive me. When I think about global health equity, in my mind as a therapist and from someone that comes from two different community organizations, the San Diego LGBT Community Center and also the San Diego Black LGBTQ Coalition, it empowers me to do research. It empowers me to look at what's available in terms of research to then help me figure out what can be done to kind of bridge the gaps that we find. So my PowerPoint is going to go over a little bit of the research that's available. And typically when I enter these spaces, I never really know what's available. I never really know who is aware of terminology and what certain things mean. So just a brief overview. This is going to talk about the mental health statistic, and there's going to be an emphasis on transgender and non-binary folks because often those communities are left out of the acronym. And so I'm so appreciative of the two other panelists for bringing up those communities and the issues that are in them. So when we talk about gender is important because it's everywhere, and people start thinking about our gender and who we are from a very young age. Prior to even being born, our parents form these visions and these scripts, and they decide the toys that we're going to use based on the gender that they think that we're going to be. So it's everywhere, and there's really not a place to avoid it. These different set of expectations. So when we talk about gender identity, and what does gender identity mean? Gender identity is a person's internal identification as male, female, both, neither, something in between, or outside of the gender binary. And I can't define this without specifying what transgender is. A person whose identity, their gender identity, is different from the gender that was assigned to them when they were born. Making it clear, a person that's assigned male at birth, which is a more appropriate way of saying, rather than biological, a person who's assigned this gender at birth. So for example here, an assigned male at birth with a female gender identity is a trans woman. And to be clear, even though in my PowerPoint it says trans women are women. So trans woman, AKA woman, assigned female at birth, male gender identity, trans male, AKA male. And as we continue going further, we also see that there are folks that are part of the non-binary community that may not identify as trans, and folks that are part of the trans community that don't identify as non-binary. It's also important to remember that cis individuals, cisgender folks, are those that identify with the assigned gender that they were born as. Separate, gender identity is one part of the spectrum, sexual orientation is another. Trans individuals can identify as bi, hetero, gay, pansexual, sapio, all kind of sexual. Now that we talked a little bit about this, brief definition of being transgender, which I won't go too much into, various different experiences. Some talk about being or feeling like they're in the wrong body. Others can identify as not being part male or female, or not being part of that binary gender identity. Again, it's independent of sexual orientation. And it's important to note that drag queens, drag kings, cross-dressers are different. A lot of trans folks may start out or might find a community in doing this work, performing. Just want to be clear though that drag queens and drag kings and cross-dressers are not exactly, it's not the same as being trans. Also common for folks to recognize from a really young age, hey, I'm trans, from the age of like 2 to 8 is the most common age. And then puberty, that age range from 13 to 19. So looking at the reports or the research that we've got so far, the Human Rights Campaign did a research study in 2018 on LGBTQ youth. This I found pretty important because they have not been able to do one since 2018. So you'll find some common trends. There's chronic levels of stress and anxiety. There's an overwhelming fear of feeling unsafe in their own homes and classrooms for these youth. And 77% reported feeling depressed, 95% reported trouble sleeping, and of people of color, only 11% believe that their ethnicity was regarded positively in the US at that time. Keeping in mind, this was 2018. So I wonder what it would look like, now. Over 50% said that they can never use the school restroom that aligns with their gender identity. And as you continue to read on, you'll notice that there are elevated mental health statistics just for LGBTQ youth, just because they're LGBTQ youth. And so we think, what can be done to try to elevate or alleviate and improve and make these things better? Only 24% reported feeling like they could be themselves at home. 78% reported not being out to their parents due to hearing their families making negative comments about the LGBTQ communities. And a common, not something that I think a lot of cisgender folks really think about, a common issue that seems to be in the news over and over again, trans youth not being able to use the restroom that makes them feel safest and most comfortable. Think about how that impacts your ability to focus on your studies, your academics. You're in your last year or your third year of high school, and you can't focus because you're not even sure which bathroom to go to. And so look at the reasons. 58% didn't feel safe using them, and 46% of those folks said that they didn't know if they were even allowed to use them. Something so common that should have a pretty clear way to solve. And so options for those youth, 65%, I try not to use the bathroom at school. Well, that doesn't sound like a really sustainable, answer. 65, I use the restrooms in locker rooms that don't match my gender identity. And therefore, they probably have to go through something that we call gender noise to be able to do that. Looking specifically at transgender mental health rates, we know that 41% of trans individuals from this study have attempted suicide. We know that nearly half of the transgender individuals suffer from depression, anxiety, or both. Highest rates for transgender youth. This rate is nearly 9 times higher than cisgender individuals. And we're not gonna have time specifically to talk about this, but it's alarming that 42% of non-binary youth reported suicide attempts. And these are mental health things. These are things that we can do something about. And where do we get started? So we're gonna just skip a couple of things to make time for other things. Looking at the 2015 US Trans Survey, which is a pretty important survey from the National Center for Transgender Equality. They're looking to do another one in 2021. There have been some financial things and then COVID that have caused that to be an issue. But looking at the data that we have so far, 29% of transgender folks live in poverty compared to 14% of the general population. 30% report being homeless at some point. Transgender folks experience unemployment at 3 times the rate of the general population. 31% reported mistreatment in the past year in a place of public accommodation. And transgender people, particularly transgender people of color, face shockingly high rates of murder, homelessness, and incarceration. With a lot of states not offering legal protections in housing, employment, and healthcare. We also, regarding healthcare, we talk about issues that can prevent folks from having access to gender affirmation care. Our last panelist talked about what UC San Diego has been doing. I appreciate the fact that there are health plans that are out there that are providing universal coverage. And we need more of that. We need more health plans that understand that being transgender is not a disorder or a diagnosis. Gender dysphoria is a diagnosis. And it's a diagnosis because it's that point where you recognize the outside does not reflect who you really are. And you're ready to do something about that. You can't keep living the way that you have been. And so there needs to be more health plans that provide universal coverage and recognize that medical necessity, these are medical necessity procedures, and that they need to be covered. The issue of gatekeeping as well, people who are not able to get coverage without talking to a doctor, without talking to a therapist first. That's something that we kind of need to continue to work on. One of the good things about the center is, in my role, I have the ability to work with folks and to write them a letter and see them like one time, maybe see them twice if it's really necessary. That's one thing that the center is trying to do to kind of help bridge this gap. In addition to many transgender and non-binary support groups that we have available at the center. So skipping ahead, we know that there's some employment issues regarding our trans community, specifically higher rates of transgender women of color not being able to secure employment. And we know that there's a tendency to then have to go to survival sex work. We also know that survival sex work increases likelihood of sexual assault, substance abuse, depression, PTSD, etc. So it'd be nice if trans women did not need to utilize survival sex work. I wonder what can be done that can help enable, allow trans folks to have easier access to jobs without needing to, go back to or doing things that endanger and increase statistics even more. And then we get to some psychological and emotional effects. A lot of this has to do with trauma, ongoing trauma that has to do with seeing stories of people being either misgendered or being killed and investigations not being done. So to this, I just want to remind folks to use your privilege where you can. As Dr. Travers said, if you're in a space where there's anti-transphobia, where there's anti-LGBTQ behavior, and you have some amount of comfort, it may not be completely comfortable, but if you have, especially if you're coming from a place of power and privilege, use that in a positive way to help empower, to let folks know about what pronouns are, to help with diversity and inclusion and equity. So we talk a little bit about what trauma is, acute versus chronic. And it's also important to just remember about non-binary folks and experiences. It's important to recognize that non-binary folks have been around for centuries. And it's not a Western phenomenon. And there's been evidence of non-binary folks within North America, Asia, and Europe, and an erasure of non-binary expressions of gender due to colonialism. Some non-binary health statistics, non-binary folks face greater levels of minority stress in comparison to some binary trans peers. This increased risk for negative mental health issues may be due to the increased misgendering and other discrimination that non-binary people experience. Looking at the numbers, 86% do not disclose non-binary status because people don't understand. 43% report not reported having being able to access gender affirmation medical care. Only 43% have reported access to that. So you have to think, what are the issues? What's causing folks to not feel like they can talk to their doctor? And in a slide that we passed, a lot of work and education goes into telling doctors and telling providers, what does it mean to be trans? And what is my body like? And what are recommendations that you can help with? So a transgender person not only has to go through like the world, but also educating their own doctor about their identity. So some other terms that are important for people are also considered: bigender, gender neutral, gender non-conforming, gender queer. And then just continuing to think about what are the barriers that are causing folks to have difficulties accessing care. So we know that a big part of improving mental health has to do with acceptance. Studies reveal positive health outcomes for LGBTQ youth whose families are supportive and accepting. And so one of the ways that the center tries to do that again is we have a SOFA group, significant other, family, friends, and allies group that family members can now Zoom in on from all over. They meet every week, I believe now. And so check out the center's website at thecentersc.org for more information. We have a pretty robust transgender program services program. And we also think about big picture. So there are things that can maybe help with families and peers and allies being supportive, but there also needs to be trans affirmative laws. We cannot forget that we need to use our power and our access to advocate for equal rights in housing and employment protection, equal treatment in hospitals, patient care, outpatient settings, more trans competent, trans aware providers for our trans community. There needs to be a removal of some of these barriers that prevent people from having access to medically necessary procedures that can help them live their lives even longer. And actually, I think cost less money than the continued therapy and medical conditions that can come from continuing to live in a space that doesn't feel safe for you. And in kind of wrapping it up, some additional resources to also check out. My organization, the Standing of Black LGBTQ Coalition, started our Emergency Black Transgender Fund for Black trans non-binary folks who need emergency assistance. The Standing with LGBT Community Center, of course, and the North County LGBT Center. Also important to note from the LGBTQ Community Center. Again, you can utilize that for trans affirmative letters, trainings. We have short-term case management. We have a name and gender marker change clinic that's available with attorneys that can help. Gender Fluid Collective has a Loving Body program, and family health centers I found pretty helpful in helping community members getting access to trans affirmative care. And that's all that I have to say. That was too much. Thank you for your time.
Thank you very much. Appreciate very much your taking the time to go through the important series of definitions that we should all be familiar with, and for paying particular attention to youth identity, mental health, and family. And finally, for pointing us in the direction of transgender resources that people may not otherwise be familiar with. So thank you to all of our speakers. We'll now move on to the panel question and answer portion of the event. We can go back to the grid and exit screen share, if you would, Pamela. We've prepared some, thank you very much. We've prepared some questions for our panel, but first we'd like to open it up to the audience to ask questions. Please put your questions into the Q&A section of the Zoom webinar window. And I would like to invite members of our Students for Global Health Events Committee, Andrea and Shreya, to join me and present and read the questions to panelists. As you're typing your questions, we wanted to let students, global health students, know that the extra credit Google form is posted in the chat. That's if you're receiving extra credit for courses for this event. Any questions? We have one question. Andrea or Shreya, do you want to take that?
Okay, so this is from Stephanie, and they ask, what role does Iatrogenics play in the LGBTQIA+ community?
That's for any of the panelists who want to address it.
I don't know what that word means.
It means illnesses that are created by healthcare professionals.
Oh, okay, I thought maybe, I'll try to take this. First of all, thank you for your question. So I am taking this question to meaning, what harm did we provide, to a person ourselves? And I think it's unseen. I mean, we talked about this before. We can't measure it because we do a terrible job as a health system creating a culturally inclusive environment to even, correctly identify and document our patients, gender identity, for instance. So I don't think we know, but I would say, probably thinking of this differently as, what kind of iatrogenic experience do we create? So we create harm as healthcare providers. Patients come into our practices and clinics. We fail to use correct pronouns, chosen name, and we're actually now giving the patient, stress, giving the patient perhaps depression, right? By being sort of, even on a healthcare side, non-inclusive and not, really thoughtful about it. So that's how I would think about the iatrogenic question.
We have another question. It's by someone anonymous. They said, or they asked, do platforms like Zoom help increase access to medical care for marginalized communities? Again, open to any of our panelists to take this question.
I think I'll take this one. So I would say yes, platforms like Zoom can help increase access. I think about the number of folks that, let's say, would not go in person to either a doctor or to like a clinic or to a support group, but they might feel more inclined to do so if all they have to do is click and log in. I've also found it really helpful for a lot of folks that either have like anxiety or depression, or like there's other things that are like involved in their mental health there. And it's also really helpful with like consultation and being able to talk to maybe surgeons or doctors that live in like San Francisco, but you're in San Diego. And so it makes it a lot easier.
Any other responses to that question? Andrea, you want to
well, maybe I'll just, I love again the access to, other platforms that are virtual, but I'll say, of course, I'm an internist, I'm a primary care doc, so I love being with my patients in the same room. I really like to spend time, sit with them, see what's really going on, and also, when you're with someone in person, sometimes there's things that you would miss on a camera. Sometimes cameras don't work well, it's sort of blurred out. And when you're with the person, there's so much more you can pick up about their health. So I really enjoy having patients in face-to-face encounters. But again, keep in mind, I'm an internist, I'm a primary care doc. So I like to check the heart, feel lymph nodes, see what's really going on with someone and not, make too many assumptions.
I think both those were really awesome answers. I completely agree with you guys. Andrea, for the next question.
Okay, so Clara asks, do any of the panelists have suggestions on how students can get involved in closing the LGBTQIA+ healthcare gap, and especially any healthcare organizations that you would like to plug or support?
I have a couple of initial thoughts. Again, UC San Diego based, the student organization Student Health Advocates, which is a UC San Diego student organization that are students that are really thinking about how do they advocate for health with other students, and their ability to help get folks into care. Their ability to really promote what is accessible at UC San Diego for our trans and non-binary communities. When I look at the information about folks who access the LGBT Resource Center here on campus, we get about 10% of the LGBTQI+ community that comes to our space. 90% of the community does not come to the LGBT Resource Center. Why? Because they're settled at UC San Diego. They have a connection. And plus we'd be completely overwhelmed, by the way, because it's thousands of people and our space would just not work. But things like student health advocates, I think, can really make a difference in terms of a student using their power right now on campus to increase access and health through advertising things on Library Walk. So just really on the ground kind of work that can change access today at UC San Diego. That's one of the things that came into my head.
Yeah, that's a really good answer. There's a lot of resources and a lot of organizations on campus especially, so completely agree with that. Our next question is by Anne. Has there been any talk to changing the definition or changing the word for gynecology/gynecologist, considering the people who have to visit one aren't always female? And this obviously wouldn't change the healthcare barriers attached, but words do have meaning and they may deter some from this healthcare. Very good question.
Oh gosh, there's just, I have to go sideways to just answer this question, which is at a national level, so many guidelines are gender-based. It just, you know, I sit on a sort of the NCCN breast panel that sets the global guidelines for breast cancer care. And it's not, the guidelines are not gender inclusive. Like, I'm like, when are we gonna like revise, scratch? This is not the way to do it. So there's not even like a recognition. So, you know, same thing, who was I? Oh, last week I was on with the AMGA, which is another sort of national organization in quality. They were talking about bone health and they made it binary. That was sort of male this, female that. And I'm like, why are we, you know, not recognizing gender minorities? This is not gender inclusive. And I have to tell you, like, it went sort of quiet. Like, I don't know that, you know, at a national level, people recognize how huge a gap in knowledge and understanding they have and how sort of the overall approach. So now you're talking about like a whole discipline, right? You refer a patient in at the front desk, they say, why are you here? Just based on what someone's wearing, right? And have the person leave the room. I mean, yes, these are very upsetting things that we're talking about. It's hard to change terminology. Each of us today, each of us can always enhance kind of, I think, our literacy and sort of our language and our advocacy, because these things won't change until we stand together.
I would also like to add something to this question, or maybe just a recommendation. I've certainly heard from folks that I've worked with at the center, specifically trans men that have gone to, you know, see a gynecologist. And one of the recommendations or things that I would hope for is if there's a way to make that space more inclusive and comfortable for those trans men going in, so that they can still have access to care, because we want that. We do want them to have access to care. We would like them to not be turned away or to have to build up so much courage just to come in or then they may not have full access to the benefits of seeing a doctor. So if that's possible, if there are certain flyers or certain images that can be swapped to make that more comfortable. Because I also noticed I had one person who said, I won't go because it's part of the women's health program. And I hear you with that. I absolutely hear what you're saying. I still need you to see someone though. Help me out here.
And I just
Very
want to
good
resonate
points.
with both of those
Yes.
answers because it is so deeply embedded. Gender is so deeply embedded in the binary. If you're trying to access care for your child as a trans person, and all you're going to is things that are about mother's milk and breastfeeding and mommy's milk, and you're just like, oh my gosh, I wasn't dysphoric, but now I'm just I am just unbelievably dysphoric trying to feed my child, because everything you have created for me to feed my child from my own body is just all about calling me mommy and mother and mommy and my breasts and all of these things. And it's, yeah, so I have a lot of strong opinions about the big picture of this question and how deeply it is embedded.
Thank you for your insight, everybody. So another question from Kayvon. It says, what kind of support groups seem to be the most effective to you? And this can be open to any speaker.
I'll hop on for a quick second. So I think that it's really helpful, at the center. I really think that it's helpful to have our weekly transgender and non-binary support group on Mondays. I found that a lot of people do enjoy going, and they seem like they're more likely to click and sign in on Zoom versus maybe go in person, which we were able to do prior to COVID. I think that the trans masculine, if I can speak, group is also a pretty active and a great support group. Diamonds in the Rough is a group specifically for trans women. It seems to be for, it seems to have a lot of POC Black people, Black women that are there. And it's something about having a space where that expression, that identity, that community can be heard and empowered and respected and affirmed. And then I think that there's some other groups that are out there. I know that House of Resilience has a trans feminine support group on Thursdays. I'm gonna just drop in, check out the San Diego Black LGBTQ Coalition, because we have these groups on our event section. They're coming to me. Thank you.
We parallel not all of those groups, but we have a trans and non-binary group at UC San Diego on Wednesday nights at 6 p.m. It's also over Zoom. We're serving a smaller population, so we can't get as specific as they can at the center because they're serving all of the region. But we do have a weekly trans and non-binary group that has great attendance. It's led by a trans person of color, really trying to be as inclusive as we can in the leadership of that group. And so that's been really effective for us here. And that's been a group for a number of years that we have reignited every year. And so that's made a difference. Also, the ways that students organize themselves in terms of support, which is not an official therapy group or counseling group, but things like OSTEM and QTPOC, which you heard tabling, I think are great ways that folks self-organize to get support. The Black LGBTQ Coalition is an example of that, right? Is coming together folks that want to support each other from a place of community.
Very good points. I love the insight you guys bring to all the questions. It's super helpful. Another question is from an anonymous attendee. In what ways does our sex education in public education settings, particularly middle school and high school level, promote gender binaries and Black gender inclusivity? In what ways can we improve this early education? And they said that, I know this is fairly broad, but I would love to hear how we might imagine that change, especially this is so relevant to middle schools and high schools, because that's what leads into colleges. And I feel like this is where people really find themselves, but especially for middle school and high school, I'd love to hear what you guys have to say about it.
Well, it's really interesting because sex education it's like one of the foundations that I think just kind of sets the rest up. Teachers or schools, education, not feeling comfortable to start talking about sex and start talking about gender identity. I mean, it's been a long time since I've had a sex education class. So I wonder what it looks like now. I've heard of protests, parents being upset that people are having these kind of discussions and thinking that it should not be a requirement. Well, my personal opinion, I think that it should be a requirement because I think that it's helpful to put that information out there from hopefully an unbiased perspective early on and normalizing it and validating it so that people, students that are in those classes don't start feeling this shame and this guilt that they may have in other areas of their life. And that becomes reinforced in school. I wonder how that plays a role in their attendance and how that plays a role back to gender noise and their ability to focus on what they're supposed to be there for and interpersonal relationship building that starts to happen at that time. So I would love for sex education to start talking more about all LGBTQ issues, having sex, men having sex with men, transgender bodies. I would love it. I don't know if anyone's going to go for that, but it's in my heart.
I have a number of thoughts and I'll be as quick as I can. I feel you, Pamela. I love it. I have a number of thoughts. Planned Parenthood provides the sex education for San Diego Unified School District. It's comprehensive and inclusive, so that's an amazing thing. I want to make sure folks know that resource. GLSEN, the Gay, Lesbian, Straight Education Network, glsen.org, has a San Diego chapter organized around out and active LGBTQI plus educators in the classroom. They're doing good work to change things around sex education. There's a coalition of youth service providing LGBT affirming organizations that call themselves the San Diego Youth LGBT Community Leadership Coalition. They're working with the school board and with different school districts to try and do that in San Diego County to address this very issue. I made notes because I want to remember, and I'm almost done. Get on your school board, get elected to the school board, change the policies of the school board, demand from your superintendent, your principals, and your teachers that they're inclusive. I know that sounds like, wow, how do I do that? But if you really want to change education in the classroom, you've got to get elected into those positions. That's why local politics matter, because they control what happens in the classroom. And so those are some thoughts about how do we get that away from the binaries, right? And so we can really make a difference.
Thank you, Sean, for those resources. So we have another question coming in from an anonymous attendee. So they've noticed that misgendering from peers, professors, and physicians has had a negative mental toll on their trans or non-binary friends and themselves as well. They identify as genderqueer. So they ask, how can we as patients and students address our providers and educators to prevent further harm and discrimination?
Maybe I'll just start. How can we as patients and students address, this large space? It's a great question. I know we don't have the answer actually, and perhaps some of you have better answers than even what we have. I'll say there's a lot of work to do. So I just want to kind of share the space that I'm frankly quite surprised that our health system has such an incredible lack of awareness just in sort of basics about sort of more cultural inclusivity. So I think the thing is, there's work to do for all. And then I think there's also work to do to actually, refine navigation. I'm going to speak more as a health doc. right now it's hard for me to find, someone perhaps that has cultural competency, that understands gender affirming surgeries in certain disciplines, right? So yeah, I sort of have like a list of my top 12 providers to go to, but now what if I need to see a neurologist? Then what? If I'm sending my patient over, I want them to have the right experience. And what if I want them to also think about the impact of the speed that we ramped up hormone therapy or something else? There might be things that are even contextually really important, right? So having a network is really important in the health setting, I think, separate and apart from improving everyone's competency. So that's a dream someday, that basically there'll be a network of individuals that are culturally inclusive, but also individuals that have skills that they can offer patients that are pertinent. So I don't know, that's my answer.
I also think, as I read that last part, how can we as patients and students address our providers and educators? I want to focus on that students and educators part. UC San Diego allows you to put your pronouns into the student record system. When faculty get their class rosters, it has your lived name, not your legal name. It has your lived name and your pronouns in their class rosters, right? So that actually, there's a system that gives them accurate information. Now, do they misgender you based on your gender presentation in the classroom because they're not looking at their class roster? Absolutely, right? I get that. But they have a system on their class roster where at least they get the pronoun. You can give it to them through the system, so they get it there. You can make it show up on Zoom. So if it's a Zoom class, like many of us here, you can make it show up there. So in terms of the students and the educators, there is a system that starts to do it. But again, the faculty have to care enough to pay attention to the class rosters, pay attention to what they're reading in the Zoom, and also in the interpersonal, not assume gender based on gender expression, allowing students to share their pronouns in the moment every time. Because in particular with students, oh my gosh, folks are on a journey, right? And the pronouns I use today might not be the pronouns that I use tomorrow. And I'm not saying that it's a willy-nilly decision. That's not what I'm saying. I'm saying that we grow and develop, and the undergraduate years are times when we really grow and develop and think about, I'm changing my pronoun now. And so what I used yesterday might not be the same today, and helping more and more faculty and TAs, I will say. So many folks, it's the TA, right? It's the grad assistant in the classroom. I think that would do a lot, that cultural competency, which Amy speaks back to what you were saying.
If anyone wants to add on, if panelists want to add on to that?
I would have just added also like reaching out to any community organizations that are already kind of doing that work. So I know about GLSEN, I know PFLAG, I know that there are different organizations that can kind of help and walk through what are the rights, how to empower the person to speak to the individual. Is there like a different department or an HR or anything else that can kind of help in bridging that gap and coming up with a nice way to say, hey, this is happening and how can we have it not happen? Because these conversations do need to occur, and it's probably gonna not only help that one person themselves, but a bunch of other people in the process.
Very good points. Our next question is from Sherry. She asked, understanding our own biases related to the LGBTQ community is a very important point that I heard one or a few of the panelists mention. Are there any resources that can help people identify unknown biases that they might have and address them?
I don't know if anyone's ever taken the implicit bias tests that are available online through Harvard. I don't know the link, but if you Google Harvard implicit bias tests, it gives you these tests and then give you some resources. That's one that I know that's very accessible, that people use all the time. It's not just for LGBTQI+ communities, though. I should say there's lots of different implicit bias, and it helps think about all of them. I'm not sure, I can't remember how many resources come afterwards, but I know for me, it's very eye-opening every time I take them about how deep it is implicit, right? It's deep. It's really hard to make explicit and to see and to change.
So we have another question from Vivian Chang. So they ask, how can we be active allies to the LGBTQIA+ community?
Listen.
I think it kind of links to the last question too, on how you can be aware of your own biases, maybe check within yourself and try to identify biases so you can prevent them from influencing you and how you view people in the future as well.
I often think of, I like the phrase active allies, right? I really detest allies as a noun and prefer it as a verb. How can I ally with LGBT people? Because in framing it as a verb, it assumes that you have to ally with people who are marginalized in order to do anything. I have experienced allies doing things to me, and they name themselves allies that are not good things, because they are not, it's an acclaimed identity as opposed to an action that is with the community. So it's somewhat of a critique, but also I think a way to think about it that is more difficult, but I think really important.
Yeah, I think I would add on to that about education. Like, you have to educate yourself about what the needs are of the community. So if you're not sure, like, start off with this implicit bias test from Harvard, and then also make sure that you're talking to friends and talk to other people that are outside of your social circle that don't just think like you. So therefore, there's more diversity and there's more of an opportunity to know what you don't know. And if we're talking about being an ally, like, look at the definition of that word. What does that mean? And look at where your standing is in life right now. So what are you able to do from the place and the position that you stand? Are you on some board and you know that board is not doing something, or they're doing something that's harmful to that community? Well, use your voice to speak up on that board. Send an email, say something. Silence is still action. We've talked about that over the past like 2 years with George Floyd. Silence is still action. So I don't expect everyone to stand up and say, no, this is not going to work every single time. But there has to be some kind of action that still is taken that helps to further that community. So like now we've had this global health, discussion. So walk away now with, here are some key things that I learned from, talking to these panelists and having this discussion. And what can I do? Like, spend like 5-10 minutes after this discussion thinking, what can I do from where I'm standing right now that's going to help our LGBTQ community? Is there a support group that I could also go to be a better advocate? Is there something that I need to donate to or volunteer for, or write something about, or talk to someone about, or talk to a family member about something that has to do with the community that I think that they kind of need to hear?
Yeah, very good point. Okay, our last question, or sorry, not our last question. Our next question is from Anne. What do you do when faced with prejudice? As I'm originally from rural Pennsylvania, very Republican area, then moved to California. I'm curious to know if you had any issues with bigotry and how you responded in a healthcare setting. I think this is a very good question. Open to all panelists.
Calling out injustice, don't sit silent. I love what Pamela said, but absolutely, I think this is kind of where the heart of my passion comes from, is having lived experiences with some of our trans and non-binary patients over the last 20 years on inpatient units. Just unspeakable, kind of just in terms of, I think, honoring individuals and their gender identity. Just, I mean, anyways, so yes, and calling it out and correcting it, just not allowing, don't be silent, you know, is what I'm going to say. And yes, of course, you know, I think even where I practice today, it's definitely quite a bit different than sort of my early part of my career, but there's still work to be done all the time, correct? You know, retrain the individuals around me, bring awareness, self-awareness for them is really important. And so, yeah, I think really important, and each of us can play that role. So.
I would say also being open to learning, like as we're talking about this now, and I think Dr. Travis mentioned it about pronouns, we have to be flexible in our own thinking that things are going to continue to change, and that's okay. Like it's okay that this person's pronouns might be different later, or that there's a new term or a different term or something that I didn't know about. Let's not be upset at ourselves for not knowing. Let's just figure out, okay, I didn't know that. Self-compassion, and then kind of moving forward. When dealing with prejudice, I personally try to just take, or bigotry, I try to take the mind point or the perspective of, this person probably doesn't have this education. There's probably something that they don't either know, or there's a miscommunication. So I'm going to try to have a conversation with them about that without assuming that they're trying to do something that's really kind of negative or harmful. And then I'll normally try to take it from there. Sometimes a person thought something, they thought that it meant something different. No, it actually, when you said this was kind of offensive. We don't use that term anymore. And that allows accountability. It also will allow like room for a provider to maybe know, oh, I made a mistake. I can learn from this mistake versus now I never want to see these people again. So I guess I just take the perspective of, let me have a conversation with you. Let me give you some education, information, resources. And then if you're still not getting it, then I might need to think about something else.
Thank you. So I believe this is the last question. So an anonymous attendee asked, have any of your peers actively lacked a sense of cultural competency? And if so, how did you personally address it?
For me, it was just said. It's about not assuming bad intentions, trying to educate, working really hard to care about a person. If I perceive they're not being culturally competent, to care enough about them as a peer to try and make a difference. At the end of the day, me getting upset at them because they didn't get something doesn't help the patient or the student get better service. It just serves me to let me rant and be angry, and that doesn't serve the patients or the students. So I kind of, in some ways, I have to humble that, right? I don't get the privilege of ranting and saying, and blowing people off and not caring. I have to care about them enough to really try and educate and really try and make a difference. It's not until it's really far down the road of actively pushing back, denying, then there's different strategies. But I don't get there very often. It's very rare that people actually, at least for me in San Diego, in this state, people are not doing the active passing laws, things like that. It's much more embedded systems. And we've kind of been talking about these deeply embedded systems that you just have to root out, which are so hard because then you challenge people's thinking. I only think of things in the binary. Yeah, stop that. And I say that flippantly, but that's really hard to do. That's really hard to do.
I have two questions that I'd like to pose, since I think we've worked through the participants' questions. One is to see if there's any elaboration you could have on your experience with the intersection of race and ethnicity. Pamela has talked some about the intersection of gender identity and racial identity, but thinking in particular about our local area, where there's multiple ethnicities, multiple groups of migrants and refugees and asylum seekers from different places. I'm wondering if any of you have any particular or unique or vivid experiences of that kind of intersection. And the second question is a question about the binary. You know, oftentimes when we think about non-binary, we're actually thinking about someone whose identity is somewhere in between the binary and is therefore kind of by default defined by being somewhere along the continuum that's defined by the binary. But yet in one of the slides, there was a reference to an identity that's completely outside the binary. Maybe that's neither male nor female, but not defined by being somewhere in between them. And I'm wondering where that fits into the definition of gender identity, or whether there are people who try to think of themselves in those terms. So the intersection.
I could take the first one, which is, I know, providing patient care, and I was pulled onto the inpatient unit in August to provide inpatient care, and certainly saw a host of patients, including individuals seeking asylum as well. So a lot of different, really tough to give linguistically inclusive care. Our Haitian Creole speaking population really has challenges for like real-time interpreter services. Can you imagine you're standing in the emergency room and you're pulling up like this computer thing and you're logging in and you're trying to get the computer to come up and the power's a little icky on the other side. Finally, you get somebody on a phone line, they're not even on a video. It's and like in and out, and like they're speaking this other language, and they may or may not even have basic health literacy, and they're doing your interpretation. So now think of adding a layer about LGBTQ plus care and some of the cultural inclusion of the questions. How are you going to ask that question to the person? How are they going to interpret the question and ask it back to the patient and get you the answer back when you can hardly speak on the phone to begin with? It is really like challenging to the hilt is what I would say. It's very, very difficult. So just remember where we have these barriers to care. When you add lack of linguistically inclusive care, wow, it's just really hard.
And I can take a shot at the second one. This is one of the ways that I love to think about that. Imagine that every person's gender is a star in the universe, unique and distinct, yet clustered into galaxies. Men and women aren't two opposite ends of a spectrum with everyone else's gender defined in between and dependent on that binary. Men and women are just two of many genders that exist in the amazing world. And so this is a slide that was first produced by Liat Wexler. I use it all the time because it breaks the paradigm of non-binary being dependent on the binary and starts to say, it's not the binary that we emphasize when we say non-binary. It's the no, I don't agree with the binary. It is the non. And in that non, you have a universe of genders and gender identities and gender expressions that start to give us more capacity psychologically, emotionally, perhaps in healthcare, perhaps in education, to hold space for the really diverse genders that are out there.
I think we have come to the end of, not the end of the line, but the end of our discussion for today, an ongoing discussion that will not be quickly concluded. And I personally want to thank all three of our panelists for taking your time and putting in your energy and your reflection. And careful, not only presentations, but careful considerations and responses to the questions. So at this point, I would like to turn things back over to Mamana, who will make some final comments and lead us out.
Thank you again, Dr. Shawdash, for acting as our MC this afternoon. I just want to give another thank you to all of our speakers, our tabling organizations, co-sponsors, advising staff, and the global health student leaders that made this event possible. We're going to be sharing several resources after the event ends, but I wanted to highlight some on the next slide, including the LGBTQ health services to find health providers and practitioners, the Gay and Lesbian Medical Association, with a provider list included, as well as two local resources, the San Diego LGBT Resource Center and the North County LGBT Resource Center. And as a reminder, the extra credit form is posted in the Zoom chat down below. And thank you for attending. I hope everyone has a wonderful rest of their afternoon. We look forward to seeing you at our future quarterly conversations and Students for Global Health events.
So long, everyone. Till the next time.